Welcome, friends. I am Dr. Deepak Kalra, Head of Department and Director Nephrology at Fortis Hospital, Shalimar Bagh. I am a nephrologist, and today I will speak about a very common topic, understanding pedal edema, cause, symptoms, and treatment. In today's session, we will discuss about pedal edema, a very common manifestation, more commonly known as swelling or Sujan. Before understanding pedal edema, let's see what is edema. Edema is the swelling of a body part from injury or inflammation. It can affect a small area or the whole body and can be caused by various causes as simple as trauma and sometimes very lethal causes such as congestive heart failure, kidney failure, liver failure, etc. It is caused due to leakage of fluid from small blood vessels into the nearby tissues. Now let us discuss in detail what pedal edema is. As I've already mentioned, in common term, you can call it swelling of the feet, ankles, or any body fluid accumulating in any body part, such as ankles, feet, most commonly in the lower legs. Majority of the time, minor occurrences of pedal edema are caused by a fluid buildup known as edema. Edema of the foot can be caused by two different mechanisms and can happen in common with each other. Pedal edema is a condition in which the feet and legs expand due to standing or sitting in the same posture for an extended period. If the edema in your feet is caused by a medical condition, it is critical to address this issue to relieve the edema. Let us come to common causes of pedal edema or पैरों की swelling. There are several factors that can cause swelling in the feet or lower part of your legs, and the most common is lifestyle related. Being overweight is a very common cause of swelling in edema or edema in feet. Excess body mass can cause fluid accumulation in the feet, legs, and ankles due to reduced blood circulation. Standing or sitting for long periods. So those people who work in a same position for long hours in sitting or standing, such as those who are standing in a queue for a very long time, or those who are sitting on computers for almost 8 hours. The muscles then are unable to pump the body fluids towards the heart, and thus because of the inactivity there is buildup of water and blood in the legs, which can cause swelling. On the other hand, causes can be sometimes related to medical diseases, and thus you should not ignore edema as and correlate it to such causes. If there is edema, you should always consult your doctor because it can be a initial manifestation of some very important diseases which should be diagnosed at the earliest, such as a blood clot in the leg. When certain components of your blood thicken and form a semi-solid mass, blood clots develop. This process can be triggered by an injury, but it can also happen inside blood vessels that are not damaged. When a blood clot develops in a vein in the leg, it can disrupt blood flow, resulting in swelling and pain of the foot. Sometimes injury or infection is the cause of edema, and then probably it is self-evident. Injury, you will always able to understand this is because of injury. But sometimes in diabetics, especially, an infection in the legs or ankle can cause swelling because of excessive blood flow to the affected area. Venous insufficiency is a very common cause of pedal edema. The leg veins or blood vessels are weakened or damaged in chronic venous insufficiency, and the veins obstruct the flow of blood back to the heart, causing blood to pool in the legs and result in swelling. Preeclampsia is a cause of swelling in pregnancy. Pregnancy, usually there is some swelling, but in preeclampsia, there is sudden onset of swelling which increases progressively very rapidly. This can be a dangerous sign, and if it is accompanied by increased blood pressure, you should immediately contact your doctor. Cirrhosis or liver disease. Cirrhosis is a condition indicating severe scarring of the liver induced by most commonly alcohol, but can be due to many viral infections. This disorder is characterized by low blood pressure, impaired circulation in the feet, legs, and ankles. Congestive heart failure is another important cause of pedal edema. One or both of the lower chambers of the heart lose their capacity to effectively pump the blood in congestive heart failure. Blood thus just gets collected in the legs ankles and feet, which are the dependent part of our body, causing edema. Kidney disease is a very, very important cause of pedal edema. Edema can occur when there is too much fluid and salt in the blood due to renal failure. Edema caused by renal disease mainly affects the legs or the dependent portion when you are standing or sitting, but in the early morning it can be seen around the eyes, which we call as periorbital edema. Inadequate lymphatic system can lead to edema. The lymphatic system of the body aids to remove the excess fluid from the tissues. If this system is compromised, such as in many post-surgery patients, some cancer patients, or patients with having lymph node disease or diseases of the lymph vessels that drain that particular area and they don't function, then that results in edema. Severe and long-term protein deficiency can cause pedal edema. So patients who are malnourished due to chronic illnesses, chronic diarrhea, in them the fluid gets accumulated because of the low proteins. It gets exudated, it comes out of the vessels and accumulates in the tissue causing edema. So the question is, how do we identify pedal edema? Symptoms of edema include swelling or puffiness of the tissue just beneath the skin, skin that is stretched or shiny, skin that retains a dimple or pit after being pressed for several seconds. Coming to the treatment of pedal edema, mild edema normally goes away on its own, especially if the affected limb is elevated above the heart. More severe edema, on the other hand, can be treated with medications that assist your body to remove extra fluid through the urine. However, based on the patient's medical history, the doctor will assess it and thus drugs will be chosen. I would like to say that do not ignore this symptom. This symptom, on one hand, can be just a manifestation of some uh, overweight or because of venous insufficiency or because of long standing. But on the other hand, it can be a sign of some dangerous diseases like heart disease, liver failure, kidney failure. And if you see edema, you should immediately report to the doctor. Do not take it lightly because it can help you detect your disease at a very early stage. Simple tests such as hemoglobin, kidney function test, liver function test, urine test to detect the protein excretion can detect early stages of liver, heart, and kidney diseases, and thus you can get treatment at a stage where these diseases can be reversed. So don't take edema as lightly. If ever edema develops, do not say that it is due to just standing for a long time or just because I have uh, not slept nicely. Do not make such excuses. Just contact your doctor, and simple tests can help you save lot of unnecessary risk later on. Edema due to any cause, you have to reduce the salt intake and the fluid intake. That is the basic management of edema. If there is edema, it indicates that there is increased salt and water in the body. Whatever may be the cause, you have to cut down on your salt intake as well as the fluid intake. Before adopting any self-care techniques, you should always consult a doctor to determine what is the most appropriate management of this edema. Lastly, I would like to suggest that reducing salt consumption and doing some daily activity can reduce the formation of edema. It is important to consult a physician if you see any signs or symptoms of edema to avoid further complications like difficulty in walking, stiffness, pain, and decreased blood circulation. Thank you.